Good morning once again. This is the Embryology lecture. Today we'll be talking about one of the organs that form immediately after gastrulation. Remember, we said gastrulation is just a procedure to change a bilaminar disc to a trilaminar disc. And we said that happens in week 3. So right after gastrulation, cardiovascular development starts. Right after gastrulation. That's the first system to develop. Cardiovascular has to do with the heart and the blood vessel. Now, in this session, I'm going to concentrate mostly on the heart. So, when do we say a baby or the embryo is alive? What's the sign that it's living? It has to do with the heart. And this heart formation comes with a lot of problems and complications. Mostly, hole in the heart is something that we do talk about. This hole in the heart can mostly be diagnosed when that child is very active, energetic, and running, usually within 2 to 3, 4, 5 years. That's how you can diagnose hole in the heart. Today, we're going to know what happens. Is hole in the heart a defect? Is this something that was needed for the developing of the embryo? Or was vice versa? What other conditions are related to the heart? Have you heard of the Fallot Tetralogy? We're going to delve in all these things in this particular lecture. So without wasting my time, let's focus on the screen. The cardiovascular system or the heart tissue develops from the mesoderm. But remember, last time we said when gastrulation is formed, we have an ectoderm that determines the nervous system and the skin, and we have a mesoderm that deals away with the muscle, the connective tissue, the cardiovascular system, and an endoderm. So today, because we're going to put more emphasis on the mesoderm, we're going to take you through the different parts of the mesoderm and then tell you exactly what they do. So let's focus on the screen. You see, if you look on the screen, we have colors here. Blue color forming the ectoderm, and then the other parts. You see, the mesoderm has been broken into different parts to show the different parts of the ectoderm. The endoderm of the mesoderm, the endoderm here is not shown. Okay, so the blue, let's start with the light blue color, the neural tube. The neural tube will induce the formation of the neural tube here will induce the formation of the notochord. Okay, and then if you look from the notochord, we have the caudal mesoderm will form the notochord, and this is where the development of the nervous system starts. Next to it, we have the paraasia mesoderm. The paraasia, para means very close to the asia part, so paraasia, that will develop into the head and the somites. The somites will develop in the sclerotum, myotome, dermatome. In other words, the skeletal system, the muscle system, and the skin aspect. Okay. Then we come to the lateral fold, the lateral mesoderm. The lateral mesoderm will develop in the somatic, that's the body, the splanchnic, that's the cavern, and the extra-embryonic aspect. Okay, the lateral mesoderm. When you bypass the lateral mesoderm, before we have the intermediate mesoderm, that's between the para and the lateral. That also will develop in the kidney and the gonads. Okay, so because we're going to talk about the cardiovascular system, we're going to put more emphasis on the area related to the cardiovascular system. You see, the funny thing about cardiovascular system is that the part that develop into the cardiovascular, we call it the cardiogenic field. Okay, this field is established in the mesoderm just after gastrulation. I mean, somewhere around 18 to 19 days, and develops into a fully functional and multi-chambered heart by the 8 weeks. It means that after gastrulation, if we add gastrulation is 3rd week, by 8 weeks of development, the small heart is functional. The small heart is ready to function. Okay, so if you look on the screen here, the blue still means ectoderm, the red and the black is the mesoderm, and the yellow here is the endoderm. So the cardiogenic field is actually a small area between the lateral mesoderm and the endoderm. Okay, so that's the cardiogenic field. So we call it the blood island. Okay, the blood island. This is what will develop into the blood vessels. Okay, so if you continue the journey, the cardiogenic field together with the endoderm will form an enclosure. And then that space, the substance within that space, the cardiogenic field, and then the layer or that cavity that the cardiogenic field finds itself becomes the pericardiac cavity. Remember, the pericardiac cavity is the space around or the position where the heart is. So it develops as the first aspect. If we take it to the cranial folds, you see, the ectoderm will develop into the nervous system, the brain and the nervous system. So you see, the nervous system contains the head. Okay, so if you look on the screen, A is showing development of the brain, the notochord, and then we have our lateral folds here. So this is the pericardiac space, a small cardiogenic field that has formed the heart tube here. When it comes to B, now the fold is infolding, going in, and then the head is outfolding. Okay, so there's a rotation. The cardiac one is going, and then the head one is coming. So at the end, the head will be anterior, and the cardiac part will be at the middle. So that is how the folds, or we call it the cranial folds. Very important to take note of that. Okay, so if you look at C, by C, the head or the developing of the brain has folded nicely, and then now the cardiogenic has turned into one, the pericardiac cavity, the heart tube is inside, and then it leaves the 4 guts superior to it. Okay, so the cranial fold is all evolved. So the first thing about it is that we have the cardiogenic field, and the cardiogenic field will undergo infolding. So the cranial fold will go up, and the cardiogenic field will come in the middle. That is why our heart is in our chest. It's not in our head, neither is it in our stomach, because the cardiogenic field makes that the cranial head folds anteriorly, and then the cardiogenic field forms to the middle. Okay, that's how our heart is in the middle. Okay, so after the fold, if we proceed on, it's showing step by step the lateral fold. So we have the cranial fold and the lateral fold. So whilst the head region is unfolding to position the heart to the chest, we have the lateral part also folding to give us a full complete heart. So let's look on the screen. A is showing the superior view of the developing embryo. B is showing only the lateral aspect. So here, this is the lateral fold, another lateral fold here. So we have our pericardiac column or space here, and then we have the endocardiac tube here. So okay, so when you come to C, you can see that the left and right endocardiac has met, forming 2 or fused endocardiac heart tube, and then the space around each of them, as shown in C, becomes a pericardial cavity. I'm taking metakin. Look at B and C carefully. You see, if you look at B, the cardiogenic, the lateral fold is happening. So you see, this is cranial fold, and at the same time we have lateral fold. So cranial and lateral folds happens at the same time. The lateral fold makes sure that the cardiogenic here meets to form one heart, whilst the cranial fold makes sure that The head goes anterior and the heart comes in the middle. Okay, so these two folds happen together, so don't get confused. Cranial fold and lateral fold. Cranial fold and lateral fold. So if you look at B, one cardiogenic area showing a small space that is named the pericardiac, and then the heart tube. The lateral fold will fuse them in C, so that the space here together with the other space here will form the pericardiac space, and the tube will meet and form the embryonic heart. If you go to D, it's cushiony small, okay? The formation of the dorsal mesocardium is also there, okay? So in D, we have two big space fused to form one, and the wall of the heart formation has started, and the endocardiac. So in conclusion, in terms of the fold, the lateral fold oppose pair heart tube primordial and bring dorsal aorta, the main line. Heart primordial fuse to form tubular heart. So the basic structure that's going to form all the heart parts start from the tube. We call it the tubular heart. The tubular heart is formed by two folds. The cranial fold, making sure that it positions the heart in the original position, and lateral fold, making sure that the two cardiac tubes or primary tubes here will fuse to form one. So these two folds are important. Don't forget, in cardiovascular system development, there are two folds, cranial folds and lateral fold. I hope it's clear. Okay. Now we have our tubular heart. What is going to happen to the tubular heart? So here, we're focusing only on the tubular heart in this particular screen session. We focus only on the tubular heart. Remember, what is shown here, the tubular heart, the space around it is a pericardia. So we're not going to talk about the space. We are going to talk about the tubular heart alone. Okay? So on the screen is a fusing cardiac primordial. So primordial means the genesis of the heart. Now, if you look at the tubular heart, we say 21 days. So this is after 3 weeks. Okay, 3 weeks. Okay, and then if you look at the other parts, now from 3 weeks going, this is what happens. That's why we're saying that the first organ to form after gastrulation is cardiovascular, or the heart. Right after gastrulation, that one starts. Lateral fold, cranial fold, and then we have the tubular heart formation. Now let's focus on the tubular heart. This is the future ventricles. Here, the middle part. So you can see the future heart divided into three. 1, 2, 3. And beside the one in the middle is the future ventricles. These are the future atria, and then this is the outer tract. Okay, so the three part is demarcated. If we progress on, from 22 to 30, we can see a very nice picture. Now, how do we have the 31? You see, the 31 looks like the heart. How do we got it? Let's go into the details. Now, the folding and rotation of the heart tube. So there's a fold and rotation. Now, at 22, I hope the blue color represents the future ventricles, the green color represents the trunk, and then the red color here represents the sinuses, okay? The sinus venosus. So we are rotating so that the green comes down. While the green is coming down, the red is going up. While the green is going up, so look at 22, 23, and 24. Okay, so by 24 days, the green is coming down and the red is going up. Okay, so we have folding and rotation. So whilst this is rotating, this one is also folding. All these cranial fold, lateral fold, forming the heart tube, and then the heart tube undergo folding and rotation happens simultaneously. It's not that one will wait for the other. Whilst this one is going, this one is also happening. So when I say 22 here, it means that right after gastrulation, this is what happens. So the rotation is anti-clockwise rotation. Anti-clockwise rotation. This is clockwise rotation, and this is anti-clockwise. So anti-clockwise side, that the future truncus is coming downwards and the fetal ventricle is going upwards, okay? So it's this. That will position these trunks at their right foot. So here we have a loop of the heart anatomy. Now we have the aorta section, the truncal section, the right ventricle, the left ventricle, the right atrium, left atrium, and this. So after the rotation, this is what we have. And then when you take a cross section of that, we have each demarcated part. So we know which one is going to form the atrium here. The right and left atrium will be here. The right and left ventricle will be here. Okay. The tract, the green will form the aortic sac. Okay. At 30 days, this is what we have. Now at 30 days, we have a complete fold. Something that looks like the heart if you look at the screen. Okay. At 30 days, we have the atrial partitioning just beginning to almost. You see, if we go back, okay, the violet color is the atrium. Here we see two different places, but they are not partitioned. So we say at day 30, they start partitioning. At day 30, the interverticular foramen is also forming. At day 30, we have the outflow tract. At day 30, proximal portion of the bulbar chordus become trabecular and form the right ventricle. The same thing at day 30, the AV canal is undivided. I mean the atrioventricular canal is undivided. Okay, so this is what happens at day 30. We have something like the heart in there, but the partition and this is not there. So from 30 days onwards, the partition starts. Let's look at the partition of the AV valve. Let's look at the partition of the AV valve. Okay, let's look at the partition of the AV valve. Partition of the AV valve is showing A, B, C, and D. If you look at A, it's part of the formation, and then by D, we have primordial septum formation and primordial septum formation at the ventricle and in the atrium. So this is the anteroventricular endocardial cushioning. Okay, so this formation is important. If you look at A, B, and C, it's a stepwise aspect showing how the valves, how the ventricles, and how the atrium are formed. Okay. Now, there's another problem related to it. The partitioning of the AV valves. AV means between the atrium and the ventricle, there's a communication. So the blood from the atrium can move to the ventricle. Okay, so we call them AV canals. There is a problem. If it fails to fuse, what will happen? Okay, so it's a space that is there. If it fails to form, what will happen? Okay, so, and when these AV canals are formed, during the development, they should be able to close by the help of the valves. Okay, but in some instance, we can still have the AV canal there without a valve. What will be the results? That will result in failure of AV endocardial cushioning to fuse. Also, this results in a common thing that happens in Down syndrome. Okay, so people with Down syndrome mostly will have a persistent AV canal. When you have the AV canal still there, it means that there's an overflow of blood from the atria to the ventricles without control. Okay, very common with Down syndrome people. Now let's look at the septum formation. Remember, between the right and the left atrium, we need a wall. The wall is what is regarded as a septum. Between the left and right ventricle too, we need a wall. Also septum. So we have septum between the atria, so we call it atrial septum. And then we have septum or wall between the ventricles. We call it ventricular septum. So I'm going to look at the formation of each of these wall. Okay, let's start with the atria. On the screen here, we see a blue abscess. So this is the atrial region, and this is the blue aspect. That's the first septum. We call it septum primum. Okay, septum primum. It means the first septum that is formed. Okay, that will form the ostium and the ostium secundum, and otherwise the first one and the second one. Okay, it's the septum secundum that will result in foramen ovale. So this is the whole thing. Let's just call the screen. Okay, so the blue one is the first septum. By the time it's formed to cover the whole thing, the second one is also forming. Okay, so there are holes in the blue one, but the second one is supposed to form and close that hole. But the second one will also form and leave a small passage between the first and second one, hence linking the right atrium to the left atrium. Foramen ovale. Septum secundum forms the foramen ovale. Please take a note of that. So in partitioning of the atria, there are two steps: the septum primus and the septum secundum. The second one is the one that illustrates or brings out the foramen ovale. As we progress, we're going to know the function of the foramen ovale. Foramen ovale is not a bad thing, it's a necessary evil. It's supposed to be there embryologically. Very important. We're going to look at it. So it leads a pathway, strength communication. So if you look on the screen, you can see 1, the blue color, 2, blue and green, and 3, the pathway, the foramen ovale creation is formed. So what is the function of the foramen ovale? There's one thing that we need to be clear about. In vivo, the lungs are not active. Though the heart formation is there, but the lungs are not active. So blood should not go to the lungs, or most blood should not go to the lungs, because oxygenation, when the baby is in the uterus, oxygen is through the placenta, not through the lungs. So we don't need blood going to the lungs, it's for nothing. But once you are born, then you need your lungs to have to get oxygen, and the oxygen needs to come to your blood, to your heart. That is when the hole in the heart is close. But embryologically, we need it badly. We call it right and left shunt. Embryologically or cardiovascularly, when we say a shunting, means diverting blood to somewhere. So we say the blood is shunted. Okay. So here we have a right and left shunt. What's the necessary of it? In the fetus, blood is originated in the placenta, as I said, and they delivered to the heart through the inferior vena cava, shunted to the left atrium through the foramen ovale. So when they come to the left, it is shunted through the foramen ovale, also shunted from the pulmonary outflow through the datus arteriosus. Now let's look at it carefully. Please, let's follow the diagram there. Let's follow the diagram. Okay? So through the inferior vena cava here, this is the inferior vena cava. Blood comes into the left. Okay? And these bloods are already contain oxygen. Okay? So to make sure they don't go in there, they pass through the foramen ovale to the right, to the left side, and then they pass through the valve, so the left atria to the left valve, and then they pass through as if they are going to the lungs. And there's a shunting there. The shunting is called pulmonary overflow. Okay, the name of that particular vessel joining that pathway to the heart again is called datus arteriosum. So if you follow here, there's a small pathway here. This one. So whilst the blood pass in here to go to the lungs, the blood is still shunted. So here, when they pass through the pulmonary, they are shunted into the descending aorta. Can you see the picture? Right from here. So instead of going to the lungs, they are shunted into the descending aorta, and then the circle starts. So it is very necessary for everybody developing baby embryo should have hole in the heart. If not, you can't survive in there. So the hole in the heart, or the foramen ovale, is not a bad thing. We know that it's created to make sure that blood does not go to the lungs. It is shunted to the descending aorta in that manner. Okay. So we have atrial septal defects. Okay. So What happens if there's a defect between the atrial septum or the septum, the barrier between the septum? Okay. Okay, let's look. So somewhere in the 5th week, we have atria in process, so the septal formation starts in the 5th week. Okay. At that time, the interventricular septum still is incompleted. So it starts with the muzzle and then continue with the membrane. Okay. So we have the muzzle septum present. So if you look at the picture here, these are the two ventricles. So the muzzle part starts joining this, and then it have a complete septum between it. Okay, so we start with the membranous septum, trying to fix in here. So the vertical between the ventricular septum is mostly successful. There's a complete septum. Just in case there is a partial one, that can be taken care of easily, because the septum between the two ventricles is a pronounced one. Okay. So this formation, we said that the heart is formed and then the greater vessels. One of the vessels that usually is compromised is the pulmonary trunk. When we say a trunk here, we mean the pulmonary artery. You see, the pulmonary artery is the blood vessel that will get blood from the right ventricle and send it to the what? To the lungs. And from the lungs, the blood will turn and come to the left atrium. And from the left atrium, they move to the AV valve. It come to the left, and then to the left to the AV valve, to the left ventricle, and is pumped through the aorta into the system. So here, the pulmonary trunk, let's take note of that. The pulmonary trunk sends blood to the lungs for oxygen. So when I say pulmonary stenosis, it means that the blood vessel that's supposed to collect blood from the heart to the lungs is compromised or is narrowed. That's what we mean by stenosis. So what's going to happen? If the one going for blood to bring to us is very small, it means that the amount of oxygen in the body will be reduced, number one. Number two, if oxygen is less in the body, there are so many complications that happens. Okay? So apart from the stenosis, that the pulmonary trunk that can be small, we can also have a very big aorta. So it's like this, pulmonary aorta. Okay? So the aorta is on top, the pulmonary is passing below to go to the lungs. So if the pulmonary is very narrow, it's because of the aorta that is big lying on it. So we have also overriding aorta. These conditions that I mentioned are found in the Fallot's distribution. In other words, Tetralogy of Fallot or Fallot's tetralogy. Fallot is somebody who saw 4 different conditions that can result in a baby turning blue, or we call it the blue baby story. The 4 conditions: number 1, the pulmonary stenosis, was the one passing beneath the aorta is very small or narrowed, and the aorta is big, overriding aorta. Also, with Fallot's tetralogy, we have a defect between the septum, between the two ventricles. Okay, so side that oxygenated blood communicate with deoxygenated blood, and then hypertrophy of the right ventricle. The right ventricle is too big, so the muscle contraction of the right ventricle is not active, because actually it's the left that is pumping to the system. So it's the left that's supposed to be bigger. But in this condition, the right rather is bigger. We have another condition that is seen, that we have patent datus arteriosus. Datus arteriosus, or the one that making sure that blood does not go to the lungs. Here, in Fallot's tetralogy, some people can still retain it in their heart formation, and it's causing them a match. So these are the conditions, the 4 conditions that result in Fallot's tetralogy: pulmonary stenosis, overriding aorta, intraventricular septum defect, and hypertrophy of the right ventricle. Fallot's tetralogy. So let's look on the screen. On the screen, you can see a boy with phallus tetralogy. Look at the nails, they are all 10 blue. When you lack oxygen in your system, you turn blue. That's why we say the blue baby. Some babies can be born and they have phallus tetralogy. When they are born, when they comes first, the midwife will see them as blue babies. So most blue babies are dealt with oxygen to change them for somehow. But when a scan is taken, we can see that the person has phallus tetralogy. Okay. Other signs of phallus tetralogy include respiratory distress, characteristics of squatting posture. When they squat, it's then that their chest is free. Okay, because the blood vessel that's supposed to send blood to the lungs is affected. Characteristics we have also cœur ensemble. That's a French word. It means heart on boot. Heart on boot. Okay, so boot-shaped hearts. When you take an X-ray, when you take the X-ray, you see the ending parts, the apex of the heart is like a boot, as shown in the picture here. Okay, so we call it cœur ensemble. In other words, heart, boot-shaped heart. Okay, and then we have cyanosis developing gradually and intermittently, and then curb fingers and toes of cyanosis. Cyanosis is when you lack oxygen and you turn blue. The blue nature is known as cyanosis. Okay, so when a baby turns blue, one of the reasons that we have to look at is the heart, the phallus tetralogy. Okay, so basically, that is where I'll end the lecture today. Okay, number one, we should know that heart, formation of the heart is a unique procedure. Okay, at the lateral fold of the mesoderm, between the lateral fold and the endothermic layer, there is a cardiogenic area or cardiogenic area. And this, during the cranial fold makes sure that the cardiogenic area becomes middle or in the chest. And the lateral fold makes sure that the tubes, there's a formation of the heart tube. Okay, so these are the reasons these two folds are most important. It doesn't end there. We have other folds. Okay, we have folding, anti-clockwise folding to create the ventricle inferiorly, the atrium laterally, and those aspects. Remember, septum formation is also there. The septum formation in the atria is by two barriers, the primary and the secondary, resulting in foramen ovale. Foramen ovale is necessary evil. It is needed in the uterus or in vivo because it shunts the blood going to the lungs into the right atria. Okay, from the left atria, and from the left atria, it is shunted into the aorta, and then the system continue to make sure that the lungs will not have any blood or much blood supply as compared to the other part of the body. So foramen ovale is necessary evil. If you are born without foramen ovale, you have a trouble. But remember, when the baby is born, this foramen ovale, now the heart, the lungs is used for the first time, so the baby will cry. This is where the shunting system also changes. Datus arteriosus becomes a tendon, and then hole in the heart of foramen ovale needs to close. But unfortunately, some people are born with that. That needs surgical intervention. Conditions related to that is called the phallus tetralogy. Phallus tetralogy starts with the septum defect. Okay, when the pulmonary trunk becomes very small and the aorta becomes big. So the one that is supposed to carry oxygen to the lungs is narrowed and the aorta is big. Okay, and then we have persistent hole in the heart, and then hypertrophy of the right ventricle instead of the left ventricle. This sign will give a blue baby. So mostly by week 8, formation of the heart is completed. Any question? So ladies and gentlemen, I'll hold in here. I've summarized the whole concept again. If you have any question, please put it on the comment section, or if you want to contribute, you are welcome. Remember, your books are your friends. Now that we've gone into the heart, the next structure we're going to look at may be the brain. Because after the heart, immediately the brain formation starts. But the brain formation starts with other organs. In our next episode, we're going to look at that. Thank you for your participation. Have a nice day.